Hello everyone, welcome to sqadia.com. I'm your presenter Sanana Rahman and the topic of this presentation is limbs. This is the last section of this presentation, so we'll be talking about the clinical correlates of the development of limbs. In this we have the limb defects, we have defects of hand, feet and digits, and we have osteogenesis imperfecta. This is the clinical takeaway of this entire lecture. I hope you are prepared for this. So, in limb defects, we first have meromelia, which is the partial absence of limbs. Here you can see somewhat rudimentary limbs have been formed in these children, but not a complete functional limb. So, amelia is complete absence of limbs. Then we have phocomelia. The long bones are absent and a rudimentary hand, feet are attached to the trunk by irregular bones. Here you can see fingers or somewhat a rudimentary hand plate or feet have been attached to the trunk while the long bones are absent. And then we have micromelia. All segments are present, but they are abnormally short. Here you can see an abnormally short bone, then again another abnormally, this is the abnormally stylopod, then very short zygopod, and finally autopods are very short as well. It is rare and it is mainly hereditary, and it is very important to talk of the thalidomide tragedy at this point. So it was early 1960s when doctors in Germany found out that there was an increase in cases of limb defects in the newborns. They tried to find out the cause, and when they investigated, they found out that the mothers were taking a sleeping pill which was called thalidomide. That sleeping pill was teratogenic to the fetus during the period of embryological development and led to limb defects, which included meromelia, amelia, phocomelia. So this was how teratogenesis due to a specific agent was established, and hence the field of teratology was born. So it is very important whenever you give a drug to see if the patient is pregnant. If the patient is pregnant and that drug has to be prescribed, you must ask the gynecologist for her expert opinion. So next we have digital defects. We have syndactyly, which is the fusing of digits. Here you can see the second toe and the third toe have been fused. There's webbing or fusing of the digits. In syndactyly, we have brachydactyly. Brachy is small, so shortened digits. Here you can see an adult normal hand but with small digits. Then we have polydactyly. Here you can see the presence of an extra finger. It can be unilateral, but it is usually bilateral. And ectrodactyly is absence of a finger or toe, which is usually unilateral. Here you can see there's a thumb and there are two fingers, but it's not a complete hand. Two of the digits are missing. This is known as actrodactyly. Now we have cleft hand. It consists of an abnormal defect between second and fourth metacarpal bones and the soft tissue. So there is an abnormal defect between the second and fourth metacarpal bones and the soft tissues. The third metacarpal and the phalanges bones are almost always absent. So very diagnostic, the third metacarpal and the phalangeal bones are almost always absent. Thumb and the index finger and fourth and fifth digits may be fused. Here you can see the fourth and fifth digits, they are fused together. Two parts of the hand are somewhat opposed to each other. This can be seen here as well. The two parts are being opposite to each other. Now there's a condition known as hand-foot genital syndrome. It is caused by the mutation in Hox A13 gene. It causes fusion of the carpal bones in small short digits. Affected females have a partially or completely divided uterus. Affected males have hypospadias. Hypos means below. when the opening of the penis is opening lies of the urethra lies below the penis, it is known as hypospadias. It can be subcoronal when it lies in this area, mid shaft when it lies mid shaft, and penoscrotal when it lies below the penis in the scrotum. Hox's D13 mutation causes a combination of syndictally and polydictally. So Hox's A13 caused hand-foot genital syndrome. However, Hox's D13 mutation, it causes a combination of syndictally and polydictally. So a person may have fused limbs as well as a lot many limbs, fused digits and extra digits at the same time. Now we have osteogenesis imperfecta, a very important clinical condition. It is characterized by shortening, bowing, and hypomineralization of the long bones. You can see bowing very clearly in this X-ray. It causes fractures in blue sclera. This is the bluing of sclera, which is pathognomic of osteogenesis imperfecta. So always be on the lookout for that. Spectrum is from mild increase in fracture frequency to life-threatening during neonatal period. So it is the disease lies on a spectrum from the mildest form is a slightly increased fracture frequency, and the severest form may be life-threatening during the neonatal period. It is usually caused by the mutation in COL1A1 or COL1A2, which causes improper collagen formation. So the collagen is not being properly formed either due to mutation in COL1A1 or COL1A2. So then we have Marfan syndrome. In Marfan syndrome, it is caused by the mutation in fibrillin FBN1 gene, which is located in chromosome 15q21.1. It affects individuals, and the affected individuals have long, thin limbs. Here you can see in the figure they have very long, thin limbs and are tall with a thin face. They are thin and they are tall. So it also may have sternal defects, which may include pectus excavatum or craniatum. So the sternum may be protruding out, or the sternum may be depressed in. The joints may have hyperflexibility. There may be the dilation and or dissection of the ascending aorta, and there may be dislocation of the lens. The lens may be dislocated in the eye. So arthrogryposis is the congenital joint contractures. It usually involves more than one joint. There are multiple causes for this. It can be due to a neurological defect, which may be a motor hormone cell deficiency or a meningomyelocele. It can be due to muscular abnormalities like myopathy, muscle agenesis, and can be due to joint and contiguous tissue problems like synostosis, abnormal development. So now we have amniotic bands. Amniotic bands may cause ring constriction and amputation of the limbs or digits. Origin is unclear as to why the amniotic bands form. These are basically bands of amnion that may cause disfiguring of the fetus. They may represent adhesion between the amnion and the affected structure. They appear due to tears in the amnion that detach and surround a part of the fetus. So it's a theory that there may be connection between the detachment of amnion, that the detached part of the amnion may surround a part of the fetus. So this is what an amniotic band looks like. This is an amniotic band. Here you can see the development of digits has been affected. So congenital hip dislocation. It consists of underdevelopment of the acetabulum and the femur. So acetabulum is that protruding hook-like portion that the femur goes into the acetabulum of the hip joint, which is a circular portion that receives the femur. It is undeveloped in congenital hip dislocation. It is relatively common and it mostly affects the females. The dislocation occurs after birth, but the bone abnormality usually develops prenatally. Frequently associated with joint capsule laxity. So the joint capsule which is surrounding the acetabulum is lax, and hence a dislocation can occur. It is more commonly seen with the breech babies, as the gynecologist or the obstetrician may be pushing and pulling a lot during a breech delivery, so it is more commonly seen with that. With this, we come to the conclusion of a presentation on the clinical correlates of the skeletal muscle of the limbs. It was a very important presentation, and the takeaway message was the clinical correlates in this section. I hope you enjoyed it. For further lectures, keep watching sqadia.com.